Doctors and nurses, what is the worst medical error that you've witnessed? Morbidly obese man has open heart surgery. Standard type of equipment is used to hold the ribcage together and close things up. He's in the ICU for recovery, typical for complicated major surgery like this. A number of cascading errors happened. For one, it was a holiday weekend. The CT who performed the procedure was in a hurry to get out of town. A nurse reported the suture looked like it could be loosening. CT hands off. Notes in the chart to monitor the site and evaluate on Monday. Patient had progressively worsening coughing fits going into the weekend, progressive pain and agitation as well. At some point during one of these fits, two nurses are attempting to manage and calm patient when they hear a snap. The nurse looks down and sees that she is holding the patient's heart in her hand, as it has been expelled after the wire holding the rib cage failed. Patient expired almost immediately. This was a malpractice suit that involved a former employer of mine and a couple of former colleagues. That's the second worst mistake I've seen. The worst one was an ortho installing a hip replacement backwards. Don't worry though, that guy's banned from the OR. Now he does peer reviews for insurance companies, telling competent docs that their treatment plan isn't medically necessary. Next story. Surgeon performed wrong side craniotomy. Patient was level 1 trauma for fall from roof. Had a scan, read by surgeon and supposedly by radiology as a brain bleed. Ran patient from trauma bay directly to the OR, no consent possible. Waived per life or death emergency protocol. Surgeon performed timeout themselves. Stated left side craniotomy for hematoma. Left side prepped and draped. Procedure began. Skull flap created. No hematoma is found. Assisting PA breaks scrub, runs over to the computer, pulls up the imaging, and it's a right-sided hematoma. I don't personally know if it was really read by radiology pre-op, actually only read by surgeon incorrectly, or he simply forgot which side it was and didn't verify. Regardless of the cause, the patient had the wrong side of their skull cut open. The correct craniotomy was performed after, but I do not know how the delay affected their outcome. Next story. A patient came in with urinary retention. He was a man in his 50s with advanced cancer, which was probably the cause of the retention. Normally in cases like this, the bladder is drained with a urinary catheter. After several painful attempts, however, no catheter could be passed. The doctor came out and told the patient and his wife that this was basically it, that nothing more could be done. He was going to shut down and die from the urinary retention. The patient had already accepted his fate, and his wife started crying. The doctor then went into the break room and discussed the case with another doctor. The second doctor immediately gave her a what the hell look and told her they could perform a suprapubic cystostomy, basically inserting the catheter by puncturing the abdominal wall. The original doctor went back to the patient and within 5 minutes of telling him he was essentially a dead man walking, said everything was fine. They were going to get the urine out after all. This wasn't her only screw-up, of course. I've seen her letting pulmonary embolisms wait for hours, but this is the one that has stayed with me the most because what the hell? To top it all off, she was incredibly self-important, which I suspect heavily influenced the way she practiced medicine, and I was supposed to learn from this doctor. I still get angry just thinking about it. Next story. Back in my ER nurse days, I caught a fellow nurse hanging 50 MEq of IVK, potassium, wide open. No IV pump. I immediately stopped the pump and disconnected the line, flushed with saline, and then informed the nurse he almost gave the patient a lethal injection. He laughed and said he was only following the order. I showed him the order, which clearly stated the very slow rate of 10 MEq an hour, and informed him of the many safety checks required to give potassium IV, which he had not completed. I told the charge nurse, doc, and filed an incident report. Second story involving the same negligent nurse. Doc ordered a urinary catheter on an 82-year-old female patient. After 20 minutes, the same nurse came out of the patient's room quite frustrated at not being able to place the catheter, and he asked if I would try. I entered the room and found the patient crying out in pain at the previous nurse's attempts. I explained the need for the catheter and asked if I could take a look and try. She agreed. What I saw next made my insides hurt. Her button down there was quite red and inflamed and bruised, like someone took a hammer to it. I quickly located the correct hole, the urethra, not to be mistaken, and I placed the catheter. I immediately informed the nurse who tried to catheterize her button the reason he was unsuccessful. He denied any mistake on his part. I held firm and informed him that it was very obvious by assessing the patient that he did not know basic female anatomy. What he tried to put it into was not a hole or even remotely similar to the urethra. I wrote up an incident report and informed the charge nurse. He remained cocky and resolute in his complete idiocy. He didn't work there much longer. Truly a moment where you wonder how in the world this person passed the testing to make it this far. Like, that sort of testing is in place for a reason, so we don't get people like this trying to treat people. Not knowing really, really basic anatomy is terrifying. Like, what else is this dude screwing up and getting away with? Next story. 2 from my residency hospital stick out that fortunately didn't involve me or even my service line. Nurse gives 5,000 of insulin, an insane dose, instead of 5,000 of heparin, a totally normal dose. Patient dies. I was on the floor it was happening on charting, and helped with a central line placement because the resident was struggling. While doing a posterior spine fixation, a screw is too long and pierces the aorta and ends a 20-something-year-old woman. I was on the trauma service and got called to help with the resus and PACU by the primary surgical team. Next story. When I worked as a nurse, I witnessed a patient fall on her side in a geriatric ward. She was unable to walk after this and became increasingly confused. I suggested she might have a hip fracture. The doctor sent her for an x-ray of her upper arm only. She had a humerus fracture, sure, but still refuses to walk. I worked that weekend and told every doctor I rounded with to send her for an x-ray. They all examined her, but no x-ray. On Monday, the head doctor was back. She lifted the blanket and saw that the leg was shortened and outwardly rotated. The x-ray revealed an uncomminuted hip fracture. She was wincing in pain for 3 days because no one listened to me. This event, among others, made me decide to study medicine. Today, I work as a doctor and keep advocating that you need to take a nurse's word seriously. Next story. Patient has major abdominal surgery and is open with a clear plastic-looking window. Patient has a pain pump going into their spine so they don't feel major open abdominal wound. Bad nurse is supposed to be checking patient every 15 minutes. Patient's a nurse aide is constantly checking patient because he's pressing buttons and pump is running, but he's screaming in pain. Nurse is alerted 4 times but says the patient is a baby and won't physically check the patient. Nurse aide risked her job going outside her scope to check patient herself and finds epidural was pulled out. Bed is soaked because meds have been pumped everywhere but the patient. Patient ripped open wound or something while thrashing and screaming in pain. Patient went back to surgery and the nurse retired less than 6 months later. Next story. I was a clinical assistant at a detox center. One of our clients had a fatal seizure from alcohol withdrawal about a week into his stay. Other CAs were literally begging the nurse to transfer him to the ER because he took a sudden downturn. The nurse on staff was so adamant that his symptoms couldn't be that severe a week into withdrawal and he had been just fine about 36 years ago. He died in his sleep that night. He was only about 30, and unlike most of our clients, was really dedicated to starting recovery. The worst part was that when the CAs were discussing reporting the nurse, one of the other nurses said, "We shouldn't bother with all that. It would be really hard on her." They reported her anyway, but she basically got a slap on the wrist. Next story. Not so much an error as it was just a horrific combination of negligence, incompetence, and blatant disregard for patient health and safety. But anybody hear about the hepatitis outbreak in Fremont, Nebraska? So, circa 2000 to 2001, picture this. Cancer clinic infusion center. Lots of sick patients, lots of chemo ports, and different chemo drugs being administered. This isn't firsthand, I didn't witness it or work there, but this is what happened. I'm not super clear on the details of how all this transpired, but a bit of background. A chemo port is a little doohickey under the skin of the chest that they can poke needles through the skin and into the port to deliver drugs, basically straight to the large vessels by the heart. They do that for chemo drugs so they don't damage the smaller peripheral blood vessels giving them IV. It's not like an IV though, where there's external bits they poke into to deliver meds. They have to poke through the skin still. It's preferred to a central or peripheral line because less infection risk since the skin is closed over it. So what this clinic decided to do, apparently in an effort to save a buck, was rather than using saline flushes, individual pre-filled syringes of saline, they would draw saline out of an IV bag in order to flush the ports with saline. They do this, I think, before and after the infusion of chemo to ensure the port is still viable, hasn't been dislodged somehow or anything, and after in order to flush the chemo drugs out of the hardware. In theory, this would be fine, except that they had a nurse there that was jamming dirty needles into the saline bags to draw up saline and then using the same saline bag on multiple patients. Some patients even reported seeing little speckles and chunks of presumably old clotted blood floating in the saline bags when they were getting low and had been used a lot. It only took one patient with hepatitis C to expose hundreds of sick patients to the virus, around 850 exposed, with 99 cancer patients contracting the virus. Biggest Hep C outbreak in history. Next story. There's a rule in medicine not to use trailing zeros, which is when you put 0.0 after a number. Doctor wrote back in paper prescription days in order for 10.0 units of insulin, a normal amount of insulin, and the nurse gave 100 units. You would very rarely bolus this much insulin at once. The patient had a hypoglycemic emergency and permanent brain damage from the seizures. The doctor should have known not to write an order like that, and the nurse should have known to not give that much insulin without verifying the order. So the dosage being like 10 times what you might expect didn't, ring any alarm bells. That was just perfectly fine in the nurse's mind. Crazy. It starts to make sense why doctors have to go through such rigorous schooling, and then it starts to make less sense how these people made it out of it. Next story. I was an EMT and was dispatched with a medic to pick up a patient from an ER, which was a glorified urgent care. Doctor was frantic, which already comes off as unfortunately inexperienced with his handoff, and said the patient had all the signs of a AAA. Medic didn't take it seriously, assumed the patient just had anxiety. We get to the hospital. Medic doesn't mention anything about a AAA to the hospital, and the patient's vitals were stable, but he couldn't sit still and was jittery, probably feeling like something was really wrong and that he was dying like they do. The ER we brought him to was and is chronically understaffed and underfunded. He got put into a room and apparently his vitals taken, and then wasn't looked at again until hours later when he was found dead. I was so mad when I heard about his outcome. I felt like I should have spoken up, but I was a baby EMT who never had previous medical experience in the past. But also screw that ER. Next story. Not a doctor or nurse, but I was sitting with a friend in the hospital post-surgery. A nurse came by and gave him his evening medications. I watched and listened to what meds they gave him. He was high as a kite from the morphine drip and had no idea what it was he was swallowing. About a half hour later, the next crew of nurses had started their shift. A nurse came to my friend's room. "Okay, time for your evening medications." I asked her what she wanted to give him, and she told me. It was the same stuff he'd gotten from the previous shift's nurse 30 minutes ago. I stopped her and told her he'd already gotten those meds, and I asked her to check the records. She argued a bit, but went to check. She came back and agreed that he had already been properly dosed, so she went off and did the rest of her rounds. I hoped that those other patients were getting the right meds on the right schedule. I don't remember what drugs my friend was given that night, or if a double dose would have been all that dangerous, but what if it had been? And why was the nurse trying to dose him twice? Why did the system allow it? Why did nobody notice that two different nurses were handing out drugs from the same schedule without verifying that they'd already been given? It just shows that a vulnerable patient should have a friend or a family member with them as advocate as much as possible. I'll never let a loved one or myself be alone in a hospital ever again. Next story. Not a doctor or nurse. I went to the emergency room after a workplace injury. Everyone I encountered was an absolute professional, but everyone I encountered was completely exhausted. This was the tail end of COVID, and a lot of people had left the industry. The resident who ended up treating me was so tired, it was like watching a drunk making a sandwich. He spent 5 minutes looking for my file because the nurse had put it in the drawer where it was supposed to go, rather than dump it on the counter. This is what I think about every time I hear about any medical error. All the people I encountered that afternoon were too tired to be driving, let alone making decisions about life and death. It's true, medical professionals, as is well known, severely understaffed. They have to work absurd hours and really just can't provide the care that they should be able to provide. People aren't made to function with that little sleep. It just doesn't work. I really don't get how it's possible they get done what they already do, let alone what's expected of them as a standard of care. Next story. I've seen so many working as an inpatient pharmacist. They all melt together to some extent. A nurse giving an oral suspension in an oral syringe with a friction-fit tip via IV is probably the dumbest. I know of a case where TPA was given when the patient was having an aortic dissection that would have been lethal had the dissection not left him dead anyway. Grabbing a drug from the fridge that can precipitate labor and giving it to someone at 32 weeks gestation because you didn't scan the med was the most acutely careless. They wanted famotidine. Next story. Veterinarian here. I still have no idea how the hell this one happened. A few years ago, a kitten came in for a fever and abdominal pain a couple days after a spay. Okay, maybe we have a surgical site infection. It happens. Worst case may be blood loss from a knot that wasn't tied down enough, or a ureter got lighted during the spay. Bad complication, but the ureter and uterine horns are right next to each other, and sometimes we see both get tied off together. It's rare, but it happens often enough that in vet school we're specifically warned to look out for this. Oh no, if only it were that. The uterus was still there. One uterine horn was still attached and in place. The other uterine horn was cut and flapping in the breeze. The uterus itself was untouched. The surgeon had removed part of the kitten's descending colon and colonic artery, cut another part of the colon, and left the rest of the colon open, part of it dying from lack of blood supply and leaking crap into the kitten's belly. The kitten was septic from this. I don't know how she was still alive. The kitten was rushed back into surgery where our specialist actually removed the uterus, flushed everything out, and reattached both ends of the colon. Barely managed to do that one. The kitten spent several days in the ICU but made a full recovery. The uterus and colon look nothing alike. Blood vessels look nothing alike either. I have no freaking clue how the vet managed to do this. Next story. Outpatient chemo clinic. Only heard, not witnessed. Nurse gets patient from waiting room to give chemo infusion. Nurse doesn't do 2 separate patient identifiers to confirm, and patient gets wrong chemo. Also heard nurse gave 10 times the normal dose of chemo to a patient because of a med error. Doctor wrote wrong amount. 2 nurses and a pharmacist don't catch it. Patient was okay, but has to be monitored much more frequently due to toxicity chemo can cause to lungs. Also, during orientation, a nurse educator witnessed a code blue, and when they were about to shock the patient, the lead said everybody clear for a shock. A doctor who did CPR put his arms up and stepped back to be clear for the shock, but his metal stethoscope was still touching the patient/bed area, and shock button was pushed. Doctor got electrocuted and died. Also heard traveler-addicted nurse steal IV narcs and used same infected needle on patients, giving a few Hep C in the process. Next story. I worked as a doctor, then in medical law and ethics, and dealt with various legal cases in the UK. Consultant anesthetist went to do a dental chair anesthetic on a child. He failed to take proper history from the father. The child had previous hospital anesthetics with major issues over the airway and was impossible to intubate. Noticed the child had a slightly unusual facial appearance but didn't go into details. The child had a genetic condition that included micrognathia, a small lower jaw often associated with significant airway problems. Failed to check his equipment before starting. The batteries in his laryngoscope, device used when intubating, were dead. Failed to check the laryngoscope in the dentist's consulting room. The bulb was broken. Failed to check the anesthetic machine. It had been corrected wrongly, so when he thought he was giving 100% oxygen, he was giving 100% nitrous oxide. Inevitably, the child developed breathing difficulties. 100% oxygen, actually nitrous oxide, was unsurprisingly of no help. And it was impossible to pass an endotracheal tube to ensure a proper airway. Not that it would have helped given the kid was being given no oxygen anyway. The child passed away and an inevitable criminal prosecution for manslaughter followed. To the guy's credit, he pleaded guilty. As far as I know, the first and possibly only doctor to do so when faced with such charges. This was quite a long time ago and the sentence was much lighter than he would have received these days. 6 months custodial sentence. It was, of course, the end of his medical career. I could tell you many other stories, but this probably sticks out the most. This was actually one of the cases that led to dental chair anesthesia being banned in the UK. Next story. I was 39 weeks pregnant. I had upper abdominal pain, lost 20 pounds, excruciating back pain, high blood pressure, and my son was less than 5 pounds. Yet doctors refused to check on him because, quote, "It's not hospital policy." I had HELP syndrome, a severe form of preeclampsia that can end the mother. I was failed by every OBGYN I saw and every ER doctor. My son died. My husband and I tried to go after them for medical malpractice, but because the official cause of death was a blood clot, we couldn't find a lawyer willing to take our case. Next story. Not a medical professional, but have seen too. My mom had a hysterectomy when she was 30, and the surgeon left surgical swabs inside her. They wrapped around her bowel. No one took her seriously for weeks until he jokingly said, "Oh, we'd better check we didn't leave anything behind." and actually investigated further. 33 years on and she still suffers. Adhesions are an absolute female dog because it's not easy to release them without making more. My auntie, Mum's sister, went in for a valve replacement on her heart. When they were removing the ECMO, they tore her vena cava and she essentially bled out on the table. They brought her back and she spent 2 weeks in ICU before they finally let her go. Her post-mortem showed she was pretty much gone when she bled out. I wish they'd just let her go then. We live in a country where it's not possible to sue in these situations, so my mum got $5 a week for 2 years for her misadventure. Fortunately, my uncle did get a payout for my auntie's death, but it was inconsequential. I miss her so much. Next story. I had a patient that had a type of myelodysplastic syndrome, where they could not create their own red blood cells. A long story short, a nurse replaced their Foley catheter and inflated the balloon too early in the urethra. This led to a large amount of bleeding and passing of large clots into the catheter bag. The patient was not sent to the hospital. This was in a skilled nursing facility for hours. The overnight nurse noticed at some point overnight and sent the patient to the hospital. The hospital flushed the catheter, drew labs, and sent them back to the facility. The patient continued passing large clots, and when I came onto shift, their blood pressure was 74/42, and they were pallor and generally unwell. No one had checked their blood pressure the entire time since returning, and the nurse I received the report from said that the hospital said they're fine, and that's why they didn't follow up. After discussion with the medical director and a phone call to their oncologist, who was paged in the hospital and told me their labs were stable in the hospital, but the hospital's HGB/HCT and RBCs were significantly higher than their last blood draw, I questioned the oncologist about how someone with this myelodysplastic syndrome could regenerate their blood cells when they're incapable, and if it's possible the labs reported for this patient were actually a different patient's in a mix-up. After a pause, they asked that I send them back to the hospital. The patient required 2 or 3 surgeries to correct the damage to the urethra and bladder. There is so much more to that story, but there was gross incompetence and medical errors across the board at the nursing facility, hospital, and even with the EMS called for transfer. This is completely unrelated, but for some reason this medical thread is just destroying me. I have to repeat like every other sentence because I say something wrong. Whether it's because I'm recording this at 1 a.m. or because it's complex medical words, who's to say? Next story. 2. My friend. Buddy of mine had a new onset of seizures. He fell and hit his head on a coffee table. Girlfriend calls a 911. Medics take him to a level 1 trauma center. New onset of seizures requires extensive testing to rule deadly stuff like tumors out. Plus, it takes time to figure out what meds. Anyway, he's up in neuro ICU and he starts seizing non-stop. They give benzos, Keppra, still seizing. So they sedate and paralyze and intubate. Rush him to CT. He had a brain bleed. So large they had to do a craniotomy where they remove a portion of the skull to relieve pressure. The screw up? Well, a nurse got the wrong room and patient and pushed heparin, the blood-thinning agent. When he hit his head, he had a concussion, a bruise on the brain. When the nurse gave the heparin, she turned the bruise into a full-on bleed. He had to learn how to walk and talk again. He was never the same. He eventually died in his sleep years later because of seizures. Second, a father, in his 40s and husband, 3 days before Christmas suffered cardiac arrest in front of his family. Family calls a 911 and starts CPR. FD and EMS arrive, take over CPR and defibrillate. They get a pulse back. Father wakes up. He's talking to medics, and because he just died, obviously needs to go to a heart hospital. Because his heart just stopped and he had great CPR done, his heart is acting a little funky. It's out of rhythm. So they need to give him an antiarrhythmic, in this case, lidocaine. It's common and well known. Standard dosing for lidocaine is 1 milligram to 1.5 milligrams per kg. Let's say he was 100 kg, he would get 100 milligrams of lidocaine IV. The doc says give it, and the nurse draws it up. But she draws up 1 gram of lidocaine. 100 times the amount. She draws and pushes and he immediately arrests. They work him for hours, but it's no use. They might as well have taken a 45 to his head. A father and husband 3 days before Christmas. In CPR, there's something called the chain of survival. Early recognition, good CPR, early defibrillation, all of these things have to go right, and your chances of survival go way, way up. And for this guy, it did. It was a good save, and the guy was freaking murdered in the ER. 3 days before Christmas. Next story. Not a healthcare worker, but a family member. My brother was diagnosed with T1D at 20 years old. Leading up to the diagnosis, he had all the classic signs. Insane dehydration. He would always be asking for water, like no amount could ever quench his thirst. Insane weight loss over a short period of time. Couldn't keep anything down, had no appetite, among other telltale signs. When he finally went to his PCP about all this, the PCP took 5 minutes with him and diagnosed him with acid reflux. 36 hours later, my brother was in DKT, diabetic-induced coma. Blood sugar was 800 something, where the normal range is 80 to 120. Luckily, he survived and is now living a normal life. The doctor visited while he was in the hospital and was crying to my mom, I should have just ordered a blood test, checked his vitals. Yeah, coulda, woulda, shoulda, buddy. I would have sued his butt, but hey, that's just me. I'm no doctor, obviously, but why would a doctor associate severe weight loss with acid reflux? Like, unless that person is vomiting every single night, I don't think that's really related at all. I guess it just didn't get considered. I'm glad he's all right now. That must have been freaky, though, and probably really annoying. Next story. Nurse accidentally gave an ICU patient a norepinephrine bolus, and patient's BP went up to 300 over 200. I was a resident at the time, and the patient died a couple days later due to COVID complications. Another time, I was a med student, and an elderly patient came into the VA hospital constipated for 7 days with abdominal pain and bloating, but had frequent overflow diarrhea, and so his PCP had advised taking Imodium, which made him more constipated. The team didn't realize that, and just thought it was a normal constipation and did routine care like laxatives, bowel stimulant, manual disimpaction, etc., but couldn't get it going despite consulting GI, colorectal, general surgery, etc., who all recommended similar. Finally got a CT and he was impacted up to the cecum, where the small intestine meets the large intestine, and needed surgery, but he perforated his large intestine and became septic and died soon after, before he could get the surgery done. So basically, we unfortunately had a patient die because of constipation. Next story. Many moons ago, when I was a medical student, the county hospital anesthetist, who rumor had it was often drunk, was so incredibly bad at his job that for limb procedures, the patient's arm would still be moving during the operation. He would physically hold the arm or leg still himself and insist he had done his job properly. Imagine my horror some 7 years later when my spouse was undergoing a major procedure and the city hospital's new anesthetist ambled in to take his pre-op history. You better bet that I paged my husband's surgeon so goddamn fast and told him everything I knew about this guy. He was horrified and called in a second anesthetist to take over. This is how you know the medical field is understaffed. People like this keep getting hired. Next story. My future husband was hospitalized for tick-borne meningoencephalitis. He was supposed to get mannitol infusions, but someone gave him 2 liters of Ringer solution. That day, I had not much work and left several hours early to visit him. I found him barely conscious and aphasic. I went to speak to the doctor and told her that the patient was almost recovered and now he's aphasic. Her response? Tick-borne encephalitis is such a disease. One day you're alive, the next one, not anymore. I kid you not. I was friends with the son of a renowned neurology professor. I called him and he called the department and found their error. My future husband was given diuretics, had an MRI that showed cerebral edema. He recovered quickly, and now for the last 15 years I joke that he should behave because he owes me his life. He was lying in bed and calmly losing consciousness, not making a fuss, and nobody noticed it. If I couldn't leave work early that day, I don't know what would have happened to my husband. Next story. I'm in dental, and I took a CE on liability and basically forensic record keeping from a woman who does forensic odontology work. She talked about some specific cases, like you do. There were some doozies, but the one that had the worst outcome was this one. Patient was a healthy 35-year-old man, had a wife, family, good career, whole 9 yards. He needed a root canal on a molar. He'd had one done before, recognized the symptoms, doc agreed and decided to put him on an antibiotic. He had no allergy to amoxicillin, had taken it before with no issues. Doc, however, had been to a presentation from an endodontist, root canal specialist, who suggested clindamycin, as it supposedly responds better to the bacteria that causes dental infections. Doc decides to give this a try. He writes the script, tells the patient that if he experiences stomach issues to stop taking it and call him. About a week later, patient calls. He's got the mega craps. wondering what to do. Doc tells him don't worry, he'll prescribe an antidiarrheal med. He does not, crucially, reiterate to the patient to stop taking the clindamycin. Also does not follow up with the patient's physician. A few days later, patient's wife calls the doc frantic. She's had to rush her husband to the hospital with excruciating abdominal pain. The hospital scrambles to try and stabilize him. The patient dies. Upon autopsy, because of course there is one, the patient is 35 years old and was perfectly healthy not 2 weeks ago. It's revealed that the patient died from a toxic megacolon from C. diff complications. Basically, the clindamycin had ended his good gut bacteria, allowing C. diff to proliferate. The diarrhea had been expelling the C. diff and saving his life. By taking the antidiarrheal med, he'd trapped it in his system, allowing it to run rampant without good gut flora to keep it in check. Patient's wife was understandably livid, sued, and won. The doc, I think, was found to have gone beyond his scope of practice when he prescribed that antidiarrheal med, and didn't do his due diligence in communicating with the patient's PCP or provided proper after-hours care. The doc, to his credit, was absolutely devastated. Some of the other cases talked about were ones where the doc in question did stupid, sneaky, underhanded crap to try and cover their tracks and acted like complete brats at trial. The woman doing the presentation said she actually felt sorry for him because his confidence was shot and he took a long time off in order to cope. He briefly returned to practicing, but then just ended up selling a few months later, never returned to the field. Just a sad case all around. It's a tough balance to strike, right? You can't be too invested because then every single thing that goes wrong, whether it's in your control or not, just destroys you. But you become too detached and you start to do a crappy job like we've heard a lot about in this thread. But of course, we're not going to hear stories about good ones. That's not why we're here. Next story. I was the patient in this situation. With 3 days left of spring break, my junior year in college, I went to urgent care with a terrible headache and a stiff neck. They immediately sent me to the ER where I was put in quarantine. They drew blood but needed to do a spinal tap to rule out meningitis. Doctor, who I knew from our local gym where I worked, and a nurse came in, told me to lay on my side and proceeded with the spinal tap. No numbing, pain meds, just be still. Needless to say, I couldn't really hold still because there was a needle being shoved into my spine. So, another nurse comes in and she basically lays on top of me to hold me still, and they perform a successful spinal tap. I wait for the results. I don't have meningitis. They send me home, which is important later. Over the next couple of days, I have a headache that is getting progressively worse to the point I can't hold my head up in class. To this day, the worst pain I've ever experienced. I went back to the ER, drove myself, whole other story, and was immediately admitted to the neuro/stroke floor. Well, hospital policy is the patient stays for 24-hour observation after a lumbar puncture. That ER doc sent me home. Because of the first failed spinal tap, I was leaking spinal fluid into my soft cavity. My brain didn't have enough fluid to float in and was smashing against the inside of my skull. Hence the headache. I spent 3 days in the hospital. I had a CT, an MRI, and countless neuro checks. A wonderful anesthesiologist performed a blood patch to seal the hole in my spinal column. Fortunately, the MRI showed I have a Chiari-1 malformation, which would have gone unnoticed. After all this, I saw that ER doc almost daily when I went to work at the gym. He never could look me in the eye and hardly ever spoke to me. I never saw a bill for the urgent care or ER visits or the hospital stay. A few years later, I worked in patient payments for that hospital. I looked at my account, and everything I went through cost over $85,000 and had been paid in full. Next story. After a 30-year ER doc career, this one still haunts me. As a brand new third-year medical student at the old Cook County Hospital doing my surgical rotation, scrubbed in for kidney transplant. The kidney has been harvested from the donor. The recipient is ready for the new kidney. The surgeon asks the nurse for the kidney, gets handed a dead and shriveled up, desiccated kidney. The nurse had put it in isopropyl alcohol instead of saline, which destroyed it. Being a doctor means you have to give bad news sometimes. This surgeon had to tell 2 people horrible news. Never found out what happened to the nurse. Next story. My 82-year-old grandfather was given a medication known in his chart he was allergic to. Stopped his heart. He was in the hospital for 2 months, and he went from being a strong, able-bodied 82-year-old to an atrophied old man. He lost his will to live. He lived another 10 years, but never recovered from that mentally or physically. Brother-in-law's father, with severe Parkinson's, went into surgery to put the electrode in his brain. During surgery, doctor cut an artery in his brain, causing a severe stroke. He's still recovering, lost his speech and his whole left side. Was never able to get the electrode put in, but his Parkinson's went away after the stroke. Next story. Patient was in a major car accident, taken to the hospital as a trauma alert, was seen and discharged within a few hours. Diagnosed as altered, but in an Uber and sent home. The Uber driver calls 911 when he gets him to his house over an hour away. Patient is altered, lethargic, and mildly uncooperative. Piece together that the patient was the driver of the absolutely destroyed car we saw a few hours earlier on the county line. Take him back to the trauma hospital as a trauma alert. We get there and they're mad. Tell us he's just a jerk and wouldn't cooperate with them. I push that he's altered and hasn't been a jerk to me. They give us a hard time, roughly handle the patient, who then punches a nurse. They call the cops to press charges. Doctor comes in and decides to go ahead and rescan him because it's protocol, even though he was, quote, fine when he was discharged. Another nurse said he was just homeless and was looking for a place to sleep, which is untrue. If he just wanted to sleep, he would have gone to bed at home, where we picked him up. He had a massive brain bleed from the wreck. Not sure if he survived. Next story. Not a doctor. When I was having my daughter, I was told at 18 weeks that I had low-lying placenta and would need another scan at 32 weeks to see if it had moved. At 32 weeks, I traveled 120 kilometers to the hospital for the scan, and they told me while my placenta had moved, it wasn't functioning properly, and they wanted to keep me in to monitor my baby. They said she was very small and not getting fed. Over the next 5 days, I had daily scans and EGGs on the baby. At 33 weeks, they decided they'd waited long enough and performed an emergency C-section. They warned me she would look like a rabbit and would weigh about 2 pounds. After missing the spot on my spine 9 times for the spinal tap, they finally got it in and did the C-section. The second they held her up, I knew she was bigger than they expected. Turns out, there was nothing wrong with her, bar the fact she had now been born 6 weeks early. She weighed 4.2 pounds, which was a fine size, but because of their misdiagnosis, she was now premature and in the NICU. Now as a teen, she's mad because she's still very small and has lung issues whenever she gets sick. Luckily, other than being very small, she has no lasting effects. I, on the other hand, had to have a hysterectomy as a result of an issue that arose from the C-section, so yeah. Next story. Not exactly a big malpractice, but my personal come-to-Jesus moment. When I was just starting out as a fresh resident, on one of my first 24-hour shifts, a woman with intense abdominal pain because of a beginning pancreatitis came into my ER in the evening. My supervisor helped me look over the case and made the call to keep her on conservative treatment through the night, as opposed to surgery, unless her condition worsens. I was unsure of how to handle her intense pain best, so he took pity on me and made a big 50 ml syringe of morphine and saline himself. Told me to administer 2 milliliters of this fluid whenever her pain levels exceeded 4, but no more. Repeat as necessary. With my current adult doctor brain, I know that the dosage he recommended was actually very conservative for acute abdominal pain, likely why he was comfortable telling me repeat as necessary. But back then, I had no idea. It was the first time morphine was in my hands. The shift was very tiring. Once in the middle of the night, I caught a tiny break and thought of trying to sleep. The call that this woman was in severe pain again yanked me out of my deep sleep. I went to her, grabbed my morphine syringe into her darkened room, and wobbling on my feet, I injected something, then wobbled back and fell over, dead to the world. Next time I woke, it was with a clearer head and at the time of the nurse's morning rounds. I realized I couldn't remember if I had looked at the amount when I injected her. I rushed to her floor and checked my syringe. I had given her 5 milliliters instead of 2. I panicked. I thought I might have ended this woman. I rushed to her room, and I found her stretching in her bed for good morning. She greeted me with a big smile and said, "Hey, Doc, that stuff was awesome. I slept really well." Nowadays, I know she hadn't been in any danger that night, but that night has put the fear of God in me. It really is the best way to learn something, to almost really screw something up, to the point where you totally think you did, but then it ends up being fine. I bet OP has always checked dosages after that, twice or even 3 times. Next story. Not a doctor or a nurse, but the patient it happened to. I'd had emergency surgery to my abdomen, and during they gave me an epidural to help with pain management afterwards. Problem was that it didn't work, but no one believed me. Then I developed an abscess that needed to be drained, and they decided I wouldn't be on anesthesia because I should already be covered by the epidural. It took 6 people to hold me down once the doctor shoved his hand into my stomach through the incision. I ripped out my IV and they had to put a new one in my thigh to give me IV morphine. 0 out of 10. Do not recommend. Next story. Not a doctor. 2 weeks ago, my doctor was in the ER for her gallbladder. She has a lot of very severe allergies. They gave morphine for the pain and she tolerated it. Several hours later, they gave her Dilaudid. Her sister and I watched her neck swell up as the med was given. We told the nurse she was going to need epi. The nurse started looking for the doctor. We used one of our EpiPens because she needed it immediately. 20 minutes later, the doctor showed up after we'd given a second EpiPen when the reaction started coming back. She was screaming at us about it being unnecessary. She wrote in my daughter's chart that she reacted to the morphine given hours earlier, not to the Dilaudid given 60 seconds before the allergic reaction. Her reasoning was that morphine was natural and more likely to cause allergic reactions than a synthetic med like Dilaudid. She then said she had a shrimp allergy, so she knew these kinds of things. She was mad about the EpiPens, but I know I made the right call, and I wouldn't apologize. I also wouldn't agree to not do it again if it became necessary. So she had my daughter moved to a different section of the ER. After surgery, my daughter had a paradoxical reaction to fentanyl and spent several hours screaming in pain until we could convince them that the morphine allergy was incorrect and she could tolerate morphine. My mother had the same reaction to fentanyl several years ago, but I honestly thought she was just being dramatic since she's known to do that. Yeah, I feel bad about that now. Next story. Not a doctor or a nurse, but I do work in the hospital. The mother comes in with water broken. Baby is only 25 weeks, but hospital does have an excellent NICU. They give the injection to prematurely develop baby's lungs for delivery, and 2 days later she feels an odd tightening in her stomach. Goes to labor suite and all seems okay, but the umbilical cord prolapses one morning. An emergency is announced. She's told she's only 3 centimeters dilated. This is not enough. And worse, baby is breaching, legs first. She was told it's a good chance she'll need a C-section. Doctor comes in and says, push, push! And she's like, no, I'm not in labor. I don't want to push. He starts pulling at the baby and she's crawling up the bed because she's thinking this isn't right. She knew she was only about 3 centimeters dilated and not 10 centimeters as needed. Doctor proceeds to keep saying push, push, and pulls at the baby. Then there is a sickening pop. She's thinking, I don't feel the baby anymore, so I must have had it. The room is in utter chaos. Then the doctor says push again and they're saying to put her to sleep. She wakes up and is told the baby died. Later, a nurse disclosed to her that the baby was decapitated during labor because the doctor was pulling so hard and her cervix was nowhere near ready. She eventually had the head removed during a C-section, and another doctor reattached the head so she could at least see the baby and say her goodbyes. The doctor was cleared of wrongdoing. The tribunal said she felt remorse for what happened and never blamed anyone else. Surely that's supposed to say pity, right? I don't think she felt remorse for anyone. Mostly because, she didn't do anything wrong. She did literally nothing wrong. This is maybe the most horrifying thing I've read in this thread. I had a feeling that's what happened, but I was like, there's no way. There's no way that could happen, right? But apparently for that one guy, the $300,000 for medical school debt was not worth it. He learned nothing. Next story. I'm an ICU nurse. Took care of a patient who came in for an elective nephrectomy due to cancer. Should have been pretty straightforward and wasn't expecting many lifestyle changes afterwards since you can live with one healthy kidney. Patient woke up in PACU and couldn't feel their legs. Rushed to CT, and turns out when the surgeon performing the procedure was supposed to be stapling off the renal artery, they somehow stapled shut the entire aorta. Basically, no blood flow was perfusing to the entire lower half of this patient's body. Then they had to have a massive 16-plus hour-long surgery to repair the aorta. They ended up doing okay, all things considered, but I still cannot believe that happened. How do you manage to staple shut a giant pulsating vessel like the freaking aorta by accident? I hope they sued the crap out of that surgeon and won. Next story. Not a doctor or a nurse, but was in the hospital room to witness a medical error. I had lung surgery last November for what was thought to be stage 3 lung cancer. It wasn't. While recovering from my right lung wedge resection, I was put into a room with an 83-year-old man who had the same surgery back in August, but his lung got infected. When I was put into the room, he was incoherent, didn't know where he was, and couldn't remember what happened to him. As I was laying there, his heart stopped. Lots of activity. Just before they called code blue, he came back. His blood sugar was red at 1 milligram. Doctor got him on a lot of glucose to bring it back up, so it didn't happen again. Everything seemed fine. He was coherent again, knew exactly where he was and why. Had a nice 3 a.m. talk with him as I couldn't sleep. Everything was okay until 6:30. Man was incoherent again, didn't know where he was, etc. Luckily, the nurse was in the room when he took a turn and gave him more glucose. His actual doctor came in on rounds at 7 a.m., read his chart, checked some things, and stormed out. I could hear him yelling from the room. Turns out the day before, someone upped the man's insulin by 300%. Dude was diabetic and someone messed up bad. Literally almost ended him. They fixed it and he was more or less fine aside from lung issues the rest of the day until I left. Next story. 3 come to mind. Wrong patient, wrong wristband on transfer in. EMS brought us a direct admit from an outside hospital. Patient is confused/nonverbal, and the nurse didn't check the wristband against the old one from the other hospital. Anyway, medicated patient when getting admission orders, labs getting run, working through the process. Later on, nurse has a patient roll in, and they're trying to go to the room this direct admit went to. Long story short, the patient earlier was supposed to go to the ICU across the hall, not our unit. Had to figure out who the hell it was. No major harm done, luckily, but eesh. That nurse never made that mistake again. My error. It's bad, and if you're squeamish about urology trauma, do not listen. I start a Foley catheter on a kid with cerebral palsy who's nonverbal. I'm doing this because I need to clamp it to prevent him from urinating, because he needs an ultrasound of the bladder to assess a possible hematoma, and it needs to be full. Anyway, I get an order to do this from the MD. I thread the catheter, but don't get a flash of urine, but this is probably expected as patient is incontinent, so it's empty. I very slowly inflate the balloon and watch for a reaction, assuming if it's not placed right, I'll see a pain response. Anyway, ultrasound done, patient comes back, I go to pull the catheter, deflate the balloon, pull it out, and immediately blood is dumping through the catheter. I fully pull it and blood is spurting everywhere. I activate a rapid response team and hold pressure with towels, not that it's going to do anything. Hospitalist comes bedside, contacts urology. We get orders to place a new catheter again as it will likely hold pressure on wherever is bleeding. I leave and I'm thinking, well, I'm screwed. There goes my career. I return for work that night. I do my shift. In the morning, I talk to my manager expecting I'm going to be told, see ya. Come to find out, even urology had difficulty getting a cath and couldn't do it. They're sure what happened was I had a false passage into the vas deferens. Apparently, cerebral palsy can predispose people to this complication. This wouldn't have happened if I got a urine flash to confirm placement. Mistakes happen. They don't call it practicing medicine or nursing for nothing. A famous paper in the nursing world was titled, "To Err is to Human." We acknowledge mistakes. We have a robust reporting system. I report my mistakes. These reports launch a root cause investigation to identify contributing factors we can control to prevent mistakes in the future. Sometimes this is further education. Sometimes it's system, policy, procedure changes. Very rarely is this punitive. You have to do something blatantly negligent or stupid. Next story. I'm not a doctor or a nurse, but I was run over by a utility van and the resident doctor in the ER told me I was fine and I could go home. Luckily, my friend at the time was a fireman and told the doctor he was nuts and he better check again. Someone else walked by and said, "Oh yeah, her hand is broken." The resident had a panicked look and walked off. They then put me in a room and he came into the room apologizing, put a cast on my hand and told me I could see an orthopedic doctor the following week. As I'm exiting the room, a trauma surgeon comes running towards me saying, "You can't leave. I just looked at your x-ray and your bones are upside down. We're transferring you to get emergency surgery." Again, the look of stupidity on that resident's face. He put a cast on my hand with my knuckles upside down. I ended up having reconstructive surgery and metal rods to hold my knuckles in place for weeks. So much for being fine. The silver lining was I got to walk around for a bit and tell kids I was related to the Wolverine with these hook-like rods sticking out of my skin in between each finger. Next story. In another life, in another career, I was a nurse. This new grad nurse had passed his training and was on one of his first independent shifts. The patient was feeling some chest pain, and they'd been prescribed nitroglycerin nitroglycerin tablets to help. This medication comes in tiny tablets that number anywhere from 25 to 100 in a bottle. The important thing is that you give one tablet at a time, and this helps to lower blood pressure, and subsequently, chest pain. An important thing to note is that the medication instructions clearly say to give one tablet. This new nurse proceeded to dump the entire bottle in the patient's mouth. Needless to say, the patient's blood pressure dropped like a rock and they coded. Fortunately, the patient survived through all of this, but this was without a doubt the most stupid and preventable mistake that I am personally aware of. Next story. I was in a car accident once where they had to use the jaws of life to get me out. The medics with the ambulance got me strapped to a board and delivered to the hospital. The ER doctor transferred me from the board to a bed without checking for any spinal injuries. They sent me in for x-rays, and after the doctor shows up in the room, he says, "You broke your collarbone and we don't do anything for that, so you need to leave." He then had a security guard remove me from the ER using a wheelchair because I couldn't walk. I was objecting the whole time and this doctor wouldn't hear it. From the time the ambulance dropped me off till the security guard threw me out was less than half an hour. The hospital called me up 3 hours after the forced discharge to inform me the x-rays showed I had broken my collarbone, 5 ribs at my spine, and my kneecap in 2 places. I was bedbound for a month before I could walk again. Next story. I was a vet assistant for a couple months. My background was in dog grooming, so I didn't know much about the medical stuff. I had no clue if what they did was right or wrong. But they were incompetent with clippers. The vet would nick the animals more than half the time when shaving for IVs, surgery prep, to see rashes, etc. They always complained that the blades were dull, yet they never sharpened them, and had us use a harsh steel brush to scrub them during the cleaning process. The worst time was when she was shaving an IV patch on the leg of an elderly toy poodle and degloved the area. She cut off that whole patch of skin instead of the hair. So now, instead of a sick appointment at the urgent care we were, the poodle had to be redirected to an emergency vet for stitches. I could see the tendons move in the dog's leg. Even though I was inexperienced, after that I kept volunteering to do any shaving needed. Surprise, surprise, we stopped having nicks. Next story. Not a doctor, but the other day I had a hospital pharmacy give me a vial of unreconstituted Rabivert and pretty much tell me, "Good luck," since they wouldn't administer the vaccine. They wouldn't take it back or give me my hard copy back. When I came back 3 hours later, after being sent away by their own ER, urgent care, and the health department, they insisted I give the vaccine back to them as it would no longer be viable. Still didn't get my hard copy back. I did not expect to spend the day wandering around the hospital or city with a stock box of Rabivert. Next story. Other hospital transferred a patient to my hospital for rehab. Was in hospital for 2 weeks and Medicaid didn't reimburse well. Saw her when she came in. Had the Foley taken out, she was incontinent of urine. She said she fell in her garage. Had no movement of her legs. Also had buttock numbness. Immediately ordered an MRI spine stat. Didn't show cord compression but showed a lung tumor incidentally. They only did a CT abdomen without contrast and found nothing. My colleague who took over did a CT with contrast for staging. Found a clot blocking the abdominal aorta. Legs were supplied only by collateral veins. Had to put her on a heparin drip. Surgery was too risky. Turned into a 4-month hospitalization. Next story. Patient came in for a mass in her thigh noticed during childbirth. Got imaging ordered by the doctor, but it was ordered as a bilateral. Imaging place sent it over as 2 reports, 1 for each side. 1 report was given to the doctor. Was a negative exam. No one on the team noticed it was for the leg without the mass. Patient returned 8 months later saying it's much bigger now. I called radiology and the report that was not in the chart showed a muscular tumor. Patient was fine in the end after surgery, not cancerous, but it was a horrible error for the new mom. Next story. My mom's case is extreme, both due to the gravity of the errors and the number of them. Unfortunately, this is all true and not exaggerated. Buckle the hell up. She was an otherwise very healthy and fit woman in her early 40s when this all happened. We now know she has a heart condition where she randomly gets an extremely low pulse to the point where she passes out. At times, it stops completely for a while. 1. She, of course, wasn't taken seriously when reporting the sudden and frequent fainting spells and had to pull strings in order to actually have this looked into. Strings she only had due to being an ICU nurse herself. 2. Eventually, she had a gadget placed that records her heart activity. A few days in, it records her heart stopping for 2 full minutes. She calls this in, but it's a new technology, and nobody working that weekend knows how to work it. So she just stays at home. Come Monday, they actually see the readings and do not let her leave the hospital. God knows how many times her heart has stopped in her sleep. 3. Fast forward to her finally getting a pacemaker. The electrodes used were new tech, and the people operating didn't have the right knowledge. So she ended up having 3 surgeries because they kept screwing up. Surgery 1. One of the electrodes isn't placed well in the heart. Needs to be redone. Surgery 2. Seems like a success, but a few weeks later she has horrible chest pain and is taken in by an ambulance. The electrodes have come loose. Surgery 3. They accidentally pierce the heart and she gets fluid in it. 4. Due to them poking around in there so many times, she ends up getting a massive blood clot, which is initially missed because the ER sends her away. Later turns out it was blocking the jugular vein. Due to said clot, she now permanently has one stiff arm and is on blood thinners for the rest of her life, which already almost ended her once, but that's a separate story. 5. We do not respond to local anesthetic the way most people do, suspecting Ehlers-Danlos syndrome. During surgeries 2 and 3, she was only numbed locally and started feeling pain toward the end of both surgeries. She kept telling them she wasn't numb and could feel everything, but they didn't believe her, so they continued operating anyway. Afterward, the surgeon said, "I hope you still like me anyway." I kid you not. She considered suing but was too traumatized to revisit it, so to speak. Next story. Not a doctor. This happened to me. Went in for scheduled C-section of my second-born. They've placed the epidural and the nurse was prepping me when I noticed I could somewhat feel the cotton and iodine she was rubbing on my belly. I tell her I can feel that, so she tested by pinching my labia really hard. Didn't feel a thing, so they just carry on as if I'm being hysterical. Once I'm in the room and strapped down, I say something to the effect of, "I could feel the iodine on my belly before," but everyone ignores me and proceeds. Doctor makes his first cut and I start screaming because I could feel the whole thing. I should have sued that hospital, but I was young and stupid. Next story. Veterinarian here joining for fun. I've seen the following. Enrofloxacin prescribed to poultry, illegal to use this antibiotic off-label in food-producing species, a rusty handsaw used for the amputation of a limb, witnessed before vet school, abdominal surgery without gloves, caps, masks, gowns, and all else, dentistry on anesthetized pets without protected airways, risk of aspiration, pneumonia, death, anesthesia monitoring by A, no one, or B, an assistant with no formal training, butorphanol used as the primary pain reliever for surgeries in dogs and cats. It's not good at pain relief, works poorly and not for very long. Pets sent home with no pain relievers after surgery, dental extractions performed by an assistant in a state that explicitly prohibits anyone who's not a veterinarian from extracting teeth, use of one needle to draw up and administer vaccines to multiple animals from different farms, sale of pre-signed health certificates and bangs, Brucella vaccine certificates to farmers without inspecting the animal or performing the vaccine personally, straight up illegal. I can go on. Who you choose as your veterinarian matters. All I really got from this is that I just shouldn't eat any farm animals. I don't know if anything has made me as uncomfortable eating meat as reading this has. Next story. I was the patient. In the grand scheme of things, it ended up not being a huge deal. For context, I have a pretty high pain tolerance and don't run to the doctors for much. I was having rectal pain to the point where I couldn't sit, I couldn't lay down, couldn't sleep. Went to my PCP and he told me I had internal hemorrhoids. I later found out these are almost never painful and most people don't even know they have them. He sent me home with some suppository steroids. Those cause even more pain. I dealt with it for about 2 weeks and then decided I was going to the ER. Showed up at the ER at around 5:30 a.m., apparently just before the ER doc's shift change. The first doc who saw me kind of shrugged it off as just hemorrhoids, but they said they'd go through the process of doing some tests. New doc came in around 6 and said she wanted to do some other tests. Ended up having a perianal abscess that needed draining. By 11 a.m. I was out of the ER and my pain level had gone from a 5 out of 5 to barely a 1. I had an annual med check appointment with my PCP a few weeks later for an unrelated chronic condition and mentioned the abscess. He had never heard of it before, which kind of surprises me because he wasn't a new doctor. He's pretty close to retirement age. Next story. Putting non-rebreather masks on people not set to an appropriate setting. A non-rebreather mask is the oxygen mask with a bag on it. It delivers 100% oxygen when set correctly. When it's not set correctly, it suffocates people. I'm a respiratory therapist for context. One night I get a call to an unresponsive patient in ER. Patient is on a non-rebreather mask set at 2 LPM. It needs to be set to at least 10 LPM to flush out the air you breathe out. 15 LPM to ensure it. The worst/best part, the nurse did this and documented everything, and documented how she had the patient on the mask at the appropriate settings, then decided to turn the oxygen basically off while they were wearing it for nearly an hour. Cherry on top, this nurse thought she was the best thing to happen to nursing. Social media posting about how good of a nurse she is, hospital gives her awards every year, etc. We have to put the patient on life support. The wife of the patient is crying and the doctor's lying about how, quote, it's a good thing you guys were here before it happened. I write the gnarliest safety report ever. Nurse was fired. Her awards couldn't hide blatant incompetence when it comes to basic life support. She moved to a small town hospital 30 miles away. Easier to hide incompetence at a rural ER. After this thread, I am just so grateful for the fact that I get to read some positive medical threads every now and then. This wasn't one of them, but it helps balance things out because if I only read this, I would never trust doctors again in my life. But remember, guys, these are cherry-picked examples. It was only asking for the worst, so we're gonna get the worst. They were, pretty bad though, huh? Anyway, that's the last story for today. I would like to thank you all so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.